So when I received the invitation to give a talk that was entitled Inspiring Early Career Researchers, I started thinking of what is needed to inspire someone else. And I was wondering which audience I would have. So I started wondering, who are you? What is it that you would like to do? And what help do you need? But unfortunately, I don't have those responses. So I hope by sharing a bit of my journey, I can inspire and lead some reflections. So it all started here, my career to research. And in the left picture, you can see, I guess, like me as a baby. And at that point, my research was only around how much time I could sleep. And then in the right, I guess you can see me, I was quite a very active kid. And the research then was around how many times it would be needed for one to be able to take a picture to me that I would be quiet. So I don't want to really take your time in terms of my child development. So let's move on to the university. So I started university studying medicine in the University of Porto, where I am originally from. And I studied abroad for 2 years. First in Italy, in a city called Siena, where you can see there in the picture me engaging in a volunteering activity, which is the Teddy Bear Hospital, which is around showing children how it is to be in hospital so that they aren't afraid when they're sick. And in the right picture, it's just like me, I think, in the city center of Warsaw in Poland. And after that, I actually won a prize from the European Commission of the best Erasmus success story when the program reached the milestone of the 2 millionth participants. So that was quite exciting. And then I finished med school. I had to choose a specialty, and I chose psychiatry because I was always very interested in the person, the society, how the human being and the society interacted with each other. But it also has a lot of opportunities with work in public health and policy. So very early on in my psychiatry training, I was offered a post actually in this master's on mental health policies and services, which was supported by the World Health Organization. And I was for 4 months in Angola, which is a sub-Saharan African country, where I was conducting my dissertation. And the study was on essentially looking at those people who were in primary care services, but also in mental health services, and looking at risks and profile of substance users. So you can see in this slide that, well, the scale that I was using is called like the ASSIST scale for those who have been doing research in this field, and essentially is a screening of the risk of having a substance use addiction. And there were a number of interventions depending on the risk that people had as a result. And in terms of the findings, it's very much in line with a wider literature. I think what was particularly interesting was around the protective factor of those who had a religious belief in terms of having a less risk of having a substance use. And this was with a sample of 402 people. So something around like 100 for each of the centers. So 100 was in outpatient services in the psychiatric hospital, and the other 100 were in 3 different primary health centers in different parts of the city that I recruited, which was, I guess, something to share in a different journey. So moving on, so halfway through, my psychiatry training, I got elected by my peers as the president of the European Federation of Psychiatry Trainees. So this is the federation that sort of represents trainees in psychiatry across Europe. And this was at the time that I was leading a study, which was also a cross-sectional study, looking at the hot topic, which is always a hot topic, brain drain. Like, why is it that people leave a country? What factors make a specific country attractive, and why is it that people leave also their country? And I should say this was in 2013, 2014. So it was at a time that the UK was part of the EU. So quite impressively, we got responses from 2,281 participants. And we asked to trainees across Europe if they had ever considered leaving the country that they currently live in. And 2/3 responded positively. Then we asked, how about now? Are you considering leaving your country? And half of them also responded positively. And then finally, we asked, what practical steps did you take towards migration, if they did? And quite impressively, 1/4 had already taken practical steps towards migration. So you can see here in this map, in darker colors, the countries that there was a higher migratory tendency, and in lighter colors, those with lower. So this sort of like illustrates a flow between the south and the north, and the east and the west. And I guess you can see the UK. I should really like emphasize that this is data from 2013-14. So we don't know what would be the impressions today. So within my interest in social context, in social contacts, I've been investigating the different concepts around social connection using different research methodologies beyond the cross-sectional surveys. Where is it that I started my research career? Looking at social isolation from an objective perspective, loneliness subjective, but also ikikomori, and using different research methods. And one of the methods that I want to just mention briefly is actually the use of social media research. So whilst I started with this notion of doing cross-sectional surveys and recruiting participants, as you very well know, there are other methods like using electronic health records data or social media data to investigate different phenomena. And one of the phenomena that I've been doing research is on ikikomori. And this is the extreme isolation within a home setting, in that people are restricted to their home environment, and they are no longer interested in other activities. And basically, we investigated this phenomenon using posts on Twitter. And basically, we were able to extract the number of tweets, the number of likes, the geolocation of tweets, to really have an understanding of who posts about these topics. And we used pre-trained neural networks to categorize the tweets and conducting emotional analysis. And you can see here in this graph that most of the tweets were neutral. The least frequent emotion was discussed. And we also compared between those who were individuals with ikikomori, in which the most frequent emotion was sadness, with those who were family or friends of people with ikikomori, in which the most frequent emotion was surprise. More recently, I've been focusing on people with psychosis. And people with psychosis, they present with negative symptoms, and this impairs their motivation in initiating and engaging in social contacts. And they also face stigma and negative attitudes towards them. And actually, recent research shows that in the past 3 decades, that stigma towards people with psychosis has worsened. And so as a result, people with psychosis are twice more socially isolated and lonely than the general population, and this affects their recovery. So I've been looking into interventions, and one intervention in particular, which is remote volunteering to address loneliness and social isolation. And so I will be soon conducting a multi-site randomized control trial to investigate the efficacy of remote volunteering over smartphones. So one patient with psychosis being connected and matched with one community volunteer, speaking over the smartphone with the different modalities that the smartphone has. And in addition, or within the randomized controlled trial, I'll be looking at a number of research methods. So first, ecological momentary assessments, which is basically asking questions to participants on different moments throughout the day to understand how is it that they are and how they are changes in the context that they may be. And I will also be conducting qualitative interviews to have a better understanding of the experiences of both volunteers and both patients with intervention. And very importantly, I will use electronic health records, so the CRIS system in the different trusts. Especially one of the aspects which we're very interested is to see the long-term impact of the intervention, so that we know that trials, one of the problems is dropout. And by using data from CRIS, and in particular the natural language processing on loneliness, we will be able to investigate the long-term impact of the intervention in the recorded loneliness of participants. So just a brief words that there will be some opportunities for those who want to contribute to the study. I'll be recruiting people with lived experience of psychosis and community volunteers to the co-production and optimization group, to the expert advisory group, and specifically linked with the trial to the trial management group and the trial steering group. And then I guess last but not least, you can actually take part in the randomized control trial if you're interested. So this was a bit of my journey, and it was quite focused on the research and the research findings. But I just want to, I guess, share with you what I think would be my advice, not only to you, but certainly to my younger self, if I had the opportunity to hear at this stage. And the first advice is around building your foundation. Start somewhere. I would even say start anywhere. You might be interested on a particular topic. You might want to work with someone. You might want to learn about a specific method. So just start. Seek mentors, seek good mentors. I think it's fundamental to have someone who is supporting you and supporting your journey. And I would say that it's more important to have a supportive mentor than maybe, I don't know, like the most famous professor on a specific field that has no interest in supporting you. Improve your writing and communication skills, master a research technique. Once you are good in something, then people will know that you have that competency, and that will also help in terms of building networks and collaborate with other people. Achieve milestones, publish. This will also give visibility about your work, explore grants early and secure funding. And this is very important in terms of building your field, being able to do your research and seeking independence. Learn skills in terms of time management. You will have different priorities and you'll need to see what is urgent, what can wait a bit. But equally, develop skills around resilience. You will have your articles rejected. You will have your grants rejected. You will have lots of things rejected. And sometimes the academic environment might be challenging, either because people, I don't know, like are jealous of you or they just don't want to support you. So it's also how to learn to deal with that. And at the same time, balance independence so that you identify your own identity and what is it that you do and want to do, whilst you collaborate, supporting you and in line with what you want to do. And then finally, hopefully, throughout this journey, you will be growing as a researcher. You will develop leadership skills. This is very important. You should lift others while you climb. Like, the academic environment is competitive, but there's a lot of scope, and I think it's fundamental that people collaborate with each other. You should stay adaptable, and of course, should have other interests and hobbies besides all the research. And I guess finally, just keep the larger picture and purpose in mind. Like, why is it that you do this? Why is it that you want to do this research within your broader professional life ambitions and your own interests? So I hope this serves as an inspiration. I guess my final comment would be, try to keep calm, and just do it. That's great.